office manager. I work in Sugarland Smile Center. We are located in Sugarland, Texas, nearby Houston, Texas. We work with about 5 to 6 staff members. Our office is a prosthodontic, so we have a setup of front desk and assistants and a lab technician. Okay, so our primary objective when we signed up for CareRevenue was for us to get assistance with our claim processing, our insurance verification, and everything that had to do with posting EOBs and insurance information into our system. I have worked with a couple of companies before that manage our insurance information, but they were very limited. They only provided such things as minor verifications and some claim processing, but we didn't get the full service like we do with RCM, where it follows the claim from beginning to end, and it takes care of all our verification and communication back and forth with our office and any issues that we might have with insurances. So the most important part of CareRevenue in our office is that it does a lot of tasks for us, which as a manager, it minimizes the workload I have in that area. If we have to be focused on dealing with claims and insurances, it takes a lot of time. With RCM, we're able to avoid all that time waste and focus on patient care and the important part of our office, which is making sure that patients are treated and we follow through their care from beginning to end. So it makes it a lot easier as a manager for me to have that help. And our front desk, of course, she's more focused on patient service instead of having to deal with insurance companies, since the RCM system does that for us. So one of the key cases that we have with RCM, which is something that I really like, is that they do follow up with our claims. Anytime that a claim is denied, they will communicate with us if there's any information we need to follow up with, or they will reach out directly to the company and deal with the claim themselves. So that's something we don't have to worry about. We just get the status on the board. And we also love their communication portal, which allows us to be able to request information and also access information ourselves for cases that we're dealing at the moment with those claims. Communication with the CareRevenue team is very easy and they're very accessible. Most of the time with previous experience I had, I would wait a couple of days for us to get answers. With CareRevenue, we immediately get answers whenever we submit a request. We are updated constantly. If I were to need to reach out to a team member, I shoot an email, and within a few hours, I already have an answer as to them taking care of my ticket. So I know that they're on top of it. For us, the key area that we've seen CareRevenue helping us is basically not losing money. Claim processing, insurance dealing is very important, and it's part of our income in our office. And with CareRevenue, we've been able to see the turnaround in that we don't have missed claims, lost claims because of staff not being on top of it. When we get the reports from CareRevenue, we know what's coming in and out. And financially, it's helped us a lot to recuperate. Whenever we incorporated with them, they were able to actually backtrack a lot of our claims that were missing, and they resend them and took care of it. So we actually were able to save a lot of money getting those claims back in the system and within their timely filing deadline. And we also don't have that issue of having to hire someone specifically for that job. They take care of all of that for us. We just oversee it and get the information from them, which as a manager makes a big difference. I don't have so much staff to overlook. I just have the CareRevenue who takes care of that, and the front desk who helps me oversee the portal. And their communication portal gives us all the information we need. So we're constantly knowing what's going on with all that information. It's a very easy to use software, and if we have any questions, their support system, their support team is always helping us out, and they're easy to reach.